Okay, step 2 is to identify any risk factors that are causing you to have pain. This could be something as simple as your posture at work. If you work at a desk and it's not ergonomically correct, maybe it's an old injury that is predisposing you to having this new injury. An example of this is we just saw a patient who had a total hip replacement on the right side, but now she's having left-sided foot pain or knee pain or even hip pain. Did that right total hip replacement predispose her to getting any of these injuries? Does your running form or does your environment at home influence any kind of risk factors that are predisposing to have this injury? Because the common thing with people who fail most treatments is that some of these risk factors are not removed or solved. If someone comes in with neck pain and their desk is not ergonomically correct, it doesn't matter what I do to the neck to treat the neck, the pain's always going to come back. And when you have someone who has failed multiple treatment approaches, there's a reason for that. And many times they've missed either the true cause or they didn't remove any of the risk factors. So step 2 is to identify and to resolve any risk factors that may predispose you to having this injury. So think about it a little bit and see if you have any risk factors that are predisposing you to having your injury or your pain. Identify them and then remove them. So step 2 is to identify any risk factors that you may have. Thanks.